I'd like to review the importance of support services for children and what that means for parents, grandparents, and children. Over the past several years, medical experts have recognized that children of all ages and backgrounds may benefit from therapy and support services. Taking your child's mental health concerns seriously is the first step in acknowledging the importance of mental health services. Finding supportive therapy and support services for children is essential to fostering their emotional well-being, promoting healthy development, and ensuring that they have the resources needed to thrive. Understanding children's mental health challenges is vital for sustaining healthy relationships, both at home and in school. For various reasons, some children may be experiencing trauma, grief, or loneliness, which may lead to mental health concerns. Parents, grandparents, and teachers should pay attention to behaviors and warning signs, such as failing grades or changes in behavior. As a parent or a grandparent, it is necessary to give children space to voice their concerns and frustrations with mental health professionals without criticism or judgment. Hi, I'm Mum. I'm the mother of 5 grown children and the grandmother of 6. For the past many years, I've been raising my 2 oldest grandchildren. Raising my grandchildren has been way more challenging than raising my own 5 children. It's not just that I'm older, but now, in this age of technology, everything is different, including parenting. So with millions of grandparents raising grandchildren around the world, I've addressed many issues facing parents and grandparents raising grandkids with my website, raisinggrandkids.com. Check it out. You may find a topic or a parenting issue that could be very helpful. This information is to help parents and grandparents understand specifics about therapy options and support services for children. The CDC, the Centers for Disease Control and Prevention, cites alarming statistics for mental health issues in children. The CDC states that 1 in 5 children in the United States has some type of developmental, behavioral, emotional, or mental health diagnosis. Finding the right type of therapy and support services is extremely important for parents and children. So what's the right type of therapy for your child? One of these 4 types of therapy may help you decide the best option for your child. First is behavioral therapy. Behavioral therapy addresses areas that may cause anxiety, addiction, substance abuse, emotional difficulties, fears and phobias, oppositional defiant disorders, ADHD, and more. Behavioral therapy focuses on ways to change and/or adjust behaviors and issues in a specific area that causes distress. Therapy and treatment include relaxation exercises, breathing patterns, and in some cases, exposure. The next therapy is cognitive behavioral therapy. Cognitive behavioral therapy is usually used as a temporary treatment to address an issue or a direct problem. Openly discussing negative or internal thought patterns with a therapist is a common approach in cognitive behavioral therapy. This may include examining past issues and various issues in your life to determine the most productive avenue to move forward. The treatment in cognitive behavioral therapy is to identify feelings and concerns someone is dealing with in their daily life that may affect one's mental health and/or physical well-being. Cognitive behavioral therapy can be used for anxiety, fears, phobias, bipolar disorder, substance abuse, and other mood disorders. Psychodynamic therapy. Psychodynamic therapy is a long-term method for mental health treatment. In psychodynamic therapy, the therapist will delve into past relationships, both personally and with your family. Psychodynamic therapy will include examining your unconscious mind and making connections between your actions and your thought patterns. Often, psychodynamic therapy will continue for many years, with treatment showing improvement in areas of depression, anxiety, substance abuse, eating disorders, and many other disorders. Humanistic therapy. Humanistic therapy addresses your views of the world at large and how it affects you personally. Humanistic therapists provide support for you to live your best life. The therapist will listen to your approach regarding concerns and issues and will help guide you positively toward your most fulfilling outcome. Humanistic therapy is person-centered therapy to determine how to accept criticism or emotional upset from others. This type of therapy can be used for self-esteem issues, effects from trauma, relationship problems, feelings of worthlessness, and other disorders. So where can I find support for my child? To find mental health care and obtain support services for your child or grandchild, contact your child's medical doctor and/or their insurance company. Once a medical health professional is working with your child, allow your child to talk as openly as possible without fear or punishment. Parents or grandparents are typically not included in therapy sessions, but may check in with the therapist on occasion to discuss overall concerns and progress. Child therapists are trained to make children feel comfortable and allow them the freedom to open up. Discussions with the child and the therapist should be private and confidential. You can find more information about support services for children by clicking this link or go to my website at raisinggrandkids.com/support services for children. If this information was helpful, check out this video about understanding fear and anxiety in children. Thanks for watching. I hope to see you soon.